the car accident that I was in 1980. So basically I think it was almost 29 years to the day that I had my knee replaced from that original operation. And over those 29 years, my leg became valgus. It was about 17 degrees from my knee going out. So it was creating problems for the rest of my body.
I decided to have the surgery because the pain was too bad. I knew that I needed to have something done. I had an X-ray and it showed the doctor and myself that things were bad. So I went to a surgeon then and went on with it quite quickly because I knew it had to be done. And I'd had heard of other people, particularly my mother, who'd had a surgery at 82, and I didn't want to wait till that age. I wanted to get it done earlier so that I could have a longer life without restrictions.
When I had my right knee, the partial replacement to that, the reason behind that being replaced, that was a fairly easy decision because it had had multiple reconstructions, and on the last reconstruction it had been reconstructed so that if it ever dislocated again, it would dislocate to the inside edge, which it did. And so when they x-rayed it, it was permanently dislocated to the inside edge. And so it was a fairly easy decision that we have to do something about this.
The doctor I was seeing at the time initially said, as I was complaining of joint pain, said, "You're too young, these things don't last long enough, we'll defer it for as long as possible." Then one day he saw me walking across the street, and the next time I consulted him, he said, "You're having a hip replacement right away." He got a functional indication of how much it was affecting me.
It got to the point that when things got really bad, and it was difficult for me sometimes to get in and out of a car, sleep. The next X-ray showed that there was in fact no cartilage left, so it was really bone on that joint, and the ball, the head of the femur, had actually flattened right out. It was really quite worn away and corroded, and then the decision was made that it was now or never.
I was in a dilemma for quite some time because I had pain in both knees, one hip, and both ankles, and the question used to be put to me, where's it most severe? And it was an unanswerable question. It was equal in all of those places. So where do we start? It was almost a closed circle. But I did bite the bullet, decided that the right knee was top priority, and then, as I've said, after that, the right hip was done very soon afterwards. I think 2 operations within 3 months.
I decided to do my own research because I really wanted to know everything that there was to know, the good things and the bad things, how long it was going to last, what were the chances of rejection, what were the chances of anything going wrong as well.
I did know about the procedure because I'd been to the hospital previously to having my operation to discuss it another time, and I'd been to, they hold at the hospital information sessions, so I'd been to those where they show you and they talk about what happens, what they're going to do, and they show you the prostheses that they put in your leg and all of that sort of thing. So I actually went to one of those.
You need to know what's going to happen. Some people wouldn't want to, but I was quite happy to know what was going to happen and what was going inside my body to be permanently inside my body. So I was quite happy with that.
Being able to do that sort of research on the internet is really fantastic. So after the initial discussions with the surgeon, who laid out the various options that I had, and I did the research myself, and then I went back to him. Really, between the two of us, we came up with the method that I went for. And that was also his preferred method. But his explanations of why it was his preferred method, I understood them after doing the research.
We have access to very complete and very accurate information. Mind you, also there's an obligation, I think that's widely accepted on the medical profession, to ensure that we have, what's the phrase, informed consent. It's an obligation.
On the day that I went to see the surgeon, for example, he said to me, "You are 34 years of age, you have arthritis in both of your knees, you need to have a replacement desperately in one of them, you need to lose a ton of weight. Have you thought about gastric banding?" And I thought, I want to stomp on this man's foot and gouge out his eyes, because I really don't like him. But actually he was probably just trying to be very direct about the importance of me needing to lose some weight. Now, it wasn't that overweight, but he was just trying to drive home to me the need to shift some weight.
I knew what I should eat, but that doesn't mean I didn't overindulge in chocolate often. And with the hip in particular, I was, I think, very, very overweight. And I used the terror factor. I just said to myself, for every layer of fat, they've got to put another layer of stitches in. And I thought about how much I'd enjoy that, and that was able to persuade me not to eat that piece of chocolate. But it wasn't easy, it was very, very difficult. It's
really important to be fit before you do it. I saw a lot of people getting ready for hip replacements who were so incredibly overweight. I looked at them and I thought, how are you ever going to recover from this? Because I mean, I was fit, and even that time, even when my hip was still really bad, I still went to a gym, so I was fit, and I knew that my recovery would be good.
I think the most important physical thing is to keep going right up till you have to go in hospital. It's no use sitting down and resting, because that won't help at all. I can remember walking with my friend in the morning the day I went into hospital. It was in agony and I was struggling, but it's very important to keep active.